Hi everyone, welcome back. As if by magic, we're all together again. So thank you very much for those really rich discussions. Really helpful things to hear, I think there. I think we'll do some very quick feedback from the groups, and I wonder if we might start with Rachel. Could you just share for maybe about 30 seconds the top things that came out of your group? Thanks.
Yes, very happy to do that. There are definitely some common themes that were coming up across the different hits. Some main challenge around digital divide. People are worried that that inequality is going to be increasing, and coming up with kind of different solutions and mitigations to that. So thinking about different initiatives such as laptop loans or exploring different channels just to ensure that that divide doesn't continue to increase. The conundrum around not being able to go out into communities at the moment because of the restrictions placed on us by central government, and a strong idea to do more cross-hit learning so that we can look at this topic collectively rather than each hit having to think about it separately.
Super. And I think that chimes really nicely, Sabrina, with what was discussed in our group. Do you want to feed some of that back now?
Yeah, I'll add to that. And so in our group discussion, I think the access to IT and the kind of the challenges that around that was a constant theme across all of our hits. Things like, I guess, the lockdown restrictions and kind of anxiety around COVID, preventing people from actually seeking healthcare, and the kind of mental health toll, and the fact that people are kind of left seemingly isolated and alone and not being able to access the right support, and no access to green spaces as well, because I think we've all learned in lockdown that it's so important to be able to be outside and to be active outside. But then again, it's that access to green space that remains a problem. So we talked about kind of the possible solutions to that, and using the telephone more, having teleconferences and telephone groups, and collaborating with different organizations to be able to kind of offer kind of similar things and learnings. And breakout groups virtually have actually become very well received by service users, which is really positive to hear. But I guess one of the things that came up as something that Bristol Health Partners could help with is the IT challenge remains the biggest challenge from what I gather. And it's about being able to share best practice and help people build the confidence and have access to these resources as many services are moving online. So that's something that I think the core team can take away and think about.
Absolutely, thank you. And then Carla, is there something you wanted to share from your group?
Hiya, so we had a really great conversation, although with a limited group, as we didn't have many, but we were sort of further discussing the one-stop shop, how we could sort of connect people up and get that going, hopefully, and sort of share some ideas, but also thinking about how we could develop that model so to work virtually, acknowledging that having a physical location for a one-stop shop may not be the most suitable, or may need to be sort of more of a hybrid model of being able to be a virtual access as well as a location. We also discussed the online and sort of virtual element of delivering care, and sort of some insights into how patients or service users may not be as honest virtually, as there's sort of a bit of a wall, and may not provide the same information, especially around mental health services, and also acknowledging the kind of online exhaustion for clinicians. Although they may work sort of similar hours, it is very different virtually, and you don't sort of get the same energy back from a person as you do delivering that care face to face. And then similar conversations around how we can identify the themes across all hits relevant of condition, and make sure we're not duplicating work but sharing resources, and how best to do that cross hit.
Wonderful, thanks Carla. And I think one way we can do that is by compiling all the notes that have come out from these discussions and sharing in our next hit roundup, which should be coming out shortly. We'll create a bit of a you said we did document, so where you've identified support needs, we'll make sure to report back to you what we're doing to respond to those. We're going to share the recording from this webinar as well, which I think hopefully will be useful as we go forward. Just a final note to mention that we're going to be shortly publishing a statement about our commitment to equality, diversity and inclusion, and to tackling health inequalities. And to accompany that, we're going to be developing an action plan with you, the HIT partners, to give some coordination around the combined efforts. So we'll be able to pick up some of what we've been talking about today. Thank you very much, everyone, for all of your time and for all of your contributions. We've really appreciated it. Also, thank you very much for the really wonderful Autumn Live team for all their technical support, and the Bristol Health Partners core team for bringing this all together. So thanks very much. We'll be sending out a feedback reminder shortly. And for now, thanks very much. See you soon.